Hi, everyone. Today, I'm extremely excited to be speaking with Cecili Eckert, who is a functional nutritionist. Cecili has been a friend of mine, and we've known each other for about 2 years now. And I'm very excited to be having this conversation, which is one of the conversations we've had offline on inflammatory bowel disease and ulcerative colitis. So I'll introduce Cecili, and I'm excited to get into it. So Cecili is a functional nutritionist, as I mentioned. She's extremely passionate about helping people with chronic digestive issues using natural methods like food and lifestyle changes to return the body to a state of balance and wellness. Having received a diagnosis of ulcerative colitis, she intimately understands the physical, emotional, social, mental challenges that accompany disease and illness. She wholeheartedly believes that there are real solutions towards and hope for healing when we work with the body as opposed to against it. She uses a very individualized approach to fully understand each client's health history and creates comprehensive plans designed to help them achieve a real feeling of nourishment, wellness, and a true sense of healing. Cecili has 3 amazing children and a wonderful husband. She dreams of visiting as many states and national parks with her family as possible. She loves learning and reading books of all kinds. So, Cecili, thank you for talking to me today, and I'm excited to discuss this important topic.
Thank you so much for having me. I'm excited. It's obviously a personal topic for me that's transformed into a professional topic as well. And so I love talking about inflammatory bowel disease.
Yeah. And so, I'll start off with some statistics. And so we roughly, when I was looking at the statistics, around about 1 million cases of ulcerative colitis in the U.S., with more and more people being diagnosed with it. And so I wanted to start by asking you a little bit about your journey. And we know in the introduction why this is such a personal topic for you. But if you could just maybe talk a little bit about ulcerative colitis and what your journey has been with it.
Yeah, sure. More than a decade now. I think it's been about 12, 13 years ago. I started experiencing some digestive issues and had gone in and out of doctor's offices trying to figure out what was going on. And always just coming out of my doctor's appointments with no real answers, just being told that, it's no big deal, take a Tums or take like Imodium AD or, different things like this. And I was also told a couple times that I had hemorrhoids. And because inflammatory bowel disease oftentimes has this component where you can see blood either on the toilet paper or in the toilet, that was pretty frightening. That's why I sought out a doctor. So they connected the blood to hemorrhoids, which made sense to me because I had 3 children back to back to back. And so when those symptoms worsened, I ended up in my gynecologist's office breaking down. And she said, okay, wait, no, this isn't normal. We really do need to get you in to see a specialist. So I went in, had a colonoscopy, and I was diagnosed with ulcerative colitis, which took about 2.5 years, this entire process. It's not uncommon, by the way, for a diagnosis to take, 2+ years. And so when I was actually excited. I thought, finally, I have an answer. I have a name for what is going wrong with my body. And plan for all of the questions that I had. And when I walked into kind of my official appointment after my colonoscopy, I could tell that the doctor was rushed. I was going to have to drop a bunch of the questions that I had. She handed me a prescription. So one of my questions was, how long am I going to have to take this medication? And she said, well, probably forever. Yeah. And I was pretty shocked. And then I said, well, I've never, ever eaten well. I've always eaten fast food, convenience foods, fried foods, just nothing that was really healthy, not very many vegetables at all. And she said 40 years of research had never uncovered a connection between inflammatory bowel disease and food. And that was kind of when my mind just exploded. I was thinking, gosh, how could that be? I have a digestive disease, so everything I put in my system must have some sort of impact. I went home, put the prescription on the table, and I just took this deep dive over the course of about 9 months trying to figure out what was my disease, and then, what are the factors that contribute to this disease? So sifting through just mountains of information. And finally, it started implementing dietary modifications.
Yeah.
And within like 2 weeks, these symptoms that I had for more than 3 years at that point just dissipated. And I was hoping that would happen, but I was honestly just really shocked by that. Mm-hmm. And so it's a terrifying experience when you're experiencing those types of symptoms that are associated with inflammatory bowel disease, not getting answers, then getting answers and not getting help. That it's the only help is a prescription medication a lot of times.
Mm-hmm. Yeah.
It's a lot. It's a lot to handle. But when my husband, we had the 3 young children, and he said, what are you thinking you're going to do after the kids go back to school? I thought, there's hundreds of thousands of people that see a GI specialist for what I'm experiencing, and they're all probably being told a similar responses, which for me, the big feeling that I got during that conversation was that I didn't have any control, that the control was in the prescription medication. And there are times when the prescription is necessary, absolutely.
Sure. Mm-hmm.
But I decided that I wanted to help other people understand just how powerful their choices were, in combination with, or, in isolation of prescription medications. Those choices that we make can be really powerful when it comes to getting into remission, for sure.
Yeah. Yeah. So, and thank you for telling us all about your story. I think your story is where a lot of the pain points that people feel in this system, where they don't feel that control, they don't feel like with such a big diagnosis, they can, go to their physician, have a detailed conversation, and then be an active part of their own treatment plan. So I think that is the pain point for many, many people. And that's something that you and I are basically trying to work on with people to give them that better option. So I want to just take a step back and just for folks, just, for people who this is a very new topic, just to talk about the fact that the term we use, inflammatory bowel disease, is more of an umbrella term which includes Crohn's disease and ulcerative colitis. And people have heard of those individually. They may not understand its connection with inflammatory bowel disease, but these are basically the 2 types of inflammatory bowel diseases. And the differences in them is that, well, firstly, the characteristic of especially like ulcerative colitis is that you have these it is an autoimmunity, so your immune system is not recognizing your own self-tissue, in this case, the large intestine, and then going and attacking that. And it's basically causing ulcerations to develop, and that's what leads to a lot of the symptoms, and, especially blood in the stool and so on, that people end up developing. So to lay that out for people, the differences between Crohn's and ulcerative colitis, and so I'm just going to speak briefly on that, which is that generally we're seeing Crohn's probably slightly more commonly, I would say, and they have a bimodal direction of in the incidence, meaning that early on in your life, so between the ages of 15 and 30, you'll generally get a possible diagnosis of ulcerative colitis and Crohn's, and then especially ulcerative colitis later on in your life, in some cases it can also develop. So we see that distribution there. And the bigger difference is that with ulcerative colitis, you see the lesions forming more so limited to the large intestine because it's a continuous formation, whereas in Crohn's you can have anything from the mouth down to the rectum because there are areas of inflamed bowel mixed with areas of normal bowel, and so that there's those what we call skip lesions, and so it's very characteristic on a colonoscopy. It's good to know which type of inflammatory bowel disease you have, but I wanted to point that out for people who may not understand the difference between the two. So let's move and kind of progress from there and say, what are the main symptoms that you find that people with ulcerative colitis are presenting with? And what are more of the red flags that when you see a patient, you're like, this is really concerning for ulcerative colitis?
Yeah, as far as the symptoms for ulcerative colitis, I do feel like, the blood factor is a lot of times the distinguishing factor, especially if someone hasn't had a colonoscopy.
Yeah.
And for example, if I have somebody that comes in undiagnosed, we run some tests, especially a specific type of stool test. Mm-hmm. If I see elevated levels of blood in the stool, then that's a marker for me to say, okay, I'd like for you to go get a colonoscopy. Yeah. Here's a referral to a GI specialist.
Yeah. And that can be microscopic blood.
You can get, if someone's, yes, yeah. Exactly. That's just stuff that we cannot see, but the test picks up on.
Yeah.
So a lot of people that have UC actually will see blood in the toilet or on the toilet paper. And so seeing that correlate with a stool test isn't surprising. But yes, there are circumstances where somebody doesn't see it, and yet it comes up on the stool test. So the blood is more common. In fact, it's not common for Crohn's disease, but very common for ulcerative colitis. And lower abdominal pain, mm-hmm. urgency issues are really big, especially for somebody that's in a flare-up. Even if you don't know that you're in a flare-up because you haven't received a diagnosis, somebody comes in and they're having anywhere from 10 to sometimes 40 bowel movements mm-hmm. a day, where it's mostly mucus and blood, and you'll see white, looks like white blood cells in the toilet or in the stool. Those types of things are very common mm-hmm. for someone in a flare-up. Mm-hmm. And abdominal pain, an inability really to feel like you can eat. So there is some, throat issues that can come up actually too, where you feel like, I feel like I'm hungry, but when I go to eat, mm-hmm. I feel like I don't think I can do this. I'm trying to think of some other, exhaustion, fatigue, those types
diarrhea
of things for sure.
Well.
You're not, mm-hmm. the urgency issue, the diarrhea issue,
and so
waking you up at night too.
Right, exactly, and chronic diarrhea, weight loss, and so sometimes you have someone with diarrhea that might span a couple of weeks. That could be an acute viral illness, something like that. But if it's been going on for years, especially, that would be a red flag as to why is this going on? What's happening? Is there an inflammatory cause underlying it? So very important to know all those. Now, one of the areas where we connect so much on is the exact pain point that you talked about, where a lot of, or most of ulcerative colitis and Crohn's disease is being dealt with by gastroenterologists naturally, because they are the ones that do the colonoscopy, do the endoscopies, and they're diagnosing and eventually managing the patients. And there's a very important need for this, certainly for the gastroenterology involvement. But what ends up happening is that in their treatment, they sometimes end up, or mostly end up, using these stronger immunosuppressive agents as the first and second and third line of treatments, like steroids, sulfasalazine, mesalamine, biologic agents like infliximab, and so on. And while these agents are potentially very strong and can help to get remission sometimes, they come a lot of times at the expense of significant side effects, to the point that someone may not be able to continue them and then has to try another medication or has to go off those medications altogether. So we both understand and acknowledge that these strong medications are needed at some point, because your symptoms can get significantly worse, and maybe the dietary and other lifestyle interventions you do aren't able to take care of the symptoms. But there, in that realm, in the GI realm, there isn't really that room for that full picture diet lifestyle involvement. Just like you mentioned, you're a GI physician talking about research not pointing to diet involvement in ulcerative colitis. And so that's a big pain point. And so where I try to tell people is that this is an immune mechanism. And so the way you have to approach it is from an immune system perspective. And that, that comes from a deep understanding of the immune system and what goes wrong in ulcerative colitis. And so, I was just going to mention that, and we can chat very briefly about that, not to bog people down too much with details, but the fact that your immune system is so heavily involved, and no one really talks about that. It's just simply a digestive gut-related problem, and it's limited to that, and there's there's nothing further, usually intellectually, from that. So I just wanted to touch on that. I don't know if you have any comments first, but I was just going to mention a little bit about the innate and adaptive immune system.
Yeah, my only comment would be that most people that I'm seeing that have ulcerative colitis or Crohn's disease don't even realize that the underlying issue is immune dysregulation.
Absolutely, yeah.
And the inflammation is the cause of that dysregulation. And so the biologics, the prednisone, all of this is working to try to shut down either the whole immune system, immune response, or specific parts of the immune response. And so those pharmaceuticals may work really well for some people, and for other people, they either have a reaction to them, or they create antibodies to those. They're no longer. I see a lot of people that have run the whole gamut of medications, and so that's why then they're saying, well, what can I do? But yes, I think most people are not even told that the big issue really is the immune system.
Yeah. And so when we talk about immune system, just from a broad bird's eye view, we have our innate immune system, which is more of, you can think of it as a general police force that goes around policing the environment inside our bodies and making sure that any toxins, microbes, any antigens are taken care of in as simple a way as they can. And these include your macrophages, your natural killer cells, your dendritic cells. Mostly this is related to barrier function. And when I say barrier, I mean your nasopharyngeal barrier, your lung barrier, your GI barrier. We have these barriers that contain mast cells and other cells that are really the first line of defense, if you would look at it like that. And so they try to consume the antigen, take care of it, remove and neutralize the threat. However, in instances in which they're not able to, where the microbe toxin gets through those defenses, the next step is your adaptive immune system, which involves your T and your B cells. And your T and your B cells are basically functioning to more like special forces and more doing very precise work in trying to specialize in getting that antigen, whatever that is, and marking it for removal, actually removing it, and then neutralizing the threat that way. So you have what are called your T helper cells. You have your T reg cells. Your T helper cells are cells that will help this arm of the immune system in its function. Your T regulatory cells will regulate the T helper and the T suppressor. The suppressor cells, because you need the activity of the immune system to be pretty involved, but then you also have to have a mechanism to shut it down, because too much activity is going to work against you. So the T regulatory cells regulate these two processes, and it's just all about keeping that balance. And then our B cells are basically working to as our antigen producing cells, and they are the antigens we produce the antibody producing, my mistake, the antibody producing cells, and the antibodies we produce bind to those antigens, and they mark them for removal from the body by T helper cells and other T cells. So all this to kind of state that our immune system is a very complex mechanism, and one person's ulcerative colitis mechanism may differ from another person's ulcerative colitis mechanism. So there are different things that we can do to try to boost up, if we can identify those mechanisms, which is not easy to do, but if we can, in the dysfunction in the immune system, whether it's too much T regulatory function, or too little T regulatory function, too much Th17 function, or whatever the dysfunction might be, if we can identify that, there are various nutraceuticals, various techniques we can try to use to rebalance that immune system out. And for people that have ulcerative colitis, this can be a real significant step in their treatment plan and in their journey, as you've seen throughout your journey. So I just wanted to mention that because I feel like it's really important and it just doesn't get talked about enough.
Absolutely. Excuse me. When client education is a big part of my practice, as I'm sure it is yours too. And so what I like to, basically how I like to explain it is that there's, usually there's an imbalance in one of two, your immune system has, it needs to be in balance. Something happens and it gets out of balance. And then we have to figure out all those contributing factors, like what are all the things that could be causing the immune system not be able to get back into balance, and work on those things. And sometimes it is a biologic, but even then I feel like as a safety net, there's all of these other things that, you and I both look across a broad spectrum of potential contributing factors to that immune dysregulation. We try to bring things back in balance when, with autoimmunity, there's communication issues within the immune system that it's hard for the immune system to get back into balance. There's a feedback loop for every process in the body, and sometimes that feedback loop isn't working properly. But using different approaches really can help level the playing field in the immune system and interrupt that inflammation cascade, that inflammatory pathway.
Yeah, ultimately it comes down to that. And for us, the deeper we go into someone's immune dysregulation, I think the more, the better outcomes we can have, because we're trying to get to the source, we're trying to get to the root of the problem and deal with it that way. So now shifting gears, and we talked about what symptoms someone comes in with ulcerative colitis, what it is, what the immune system dysregulation is. Now, if someone does come to you more from a practical point of view for people then that they can take away from, is that, we want to make sure we have a good diagnosis with definitely a colonoscopy for confirmation with a biopsy, but also certain blood tests where we can check your complete blood count, see if there's any white blood cell dysregulation or imbalances there, and also antibody levels. So ulcerative colitis is associated with an antibody called the ANCA, or anti-neutrophil cytoplasmic antibody, which is elevated in about 60 to 70% of patients with ulcerative colitis. And so we have some of these surrogate markers for inflammatory bowel disease that we can use if we're not able to get a colonoscopy right away or a confirmatory test right away. So now moving more towards treatment options, what is good advice for someone, let's say they just got a diagnosis of ulcerative colitis through a colonoscopy, they don't know what to do, they want to take an approach that is, like you, not just medication, but a combination of things. So what should their first few steps be in terms of diet and lifestyle to get them going in that direction and get some relief from symptoms? Yeah,
so I think the very first approach is to try dietary modifications. I obviously had amazing success with modifying my own diet. But the trick really is trying to figure out which foods you may be reacting to, as opposed to, there are some foods that most practitioners look at to just eliminate right away. And so I think, as if someone's in a flare-up as far as food is concerned, you want to move away from raw foods and move into soft cooked vegetables, pureed foods, soups, things that are very soothing and easy on the digestive tract. You have to imagine that if you have ulcerations, in the digestive tract, you want to be very gentle, and you want it to be able to just rest as much as possible. Healing can happen, of course, slowly over time when we're resting the digestive system. So I'd say moving away from raw foods into softer foods is really step one. Eliminating anything that's going to be quick food for the potential overgrown bacteria, viruses, yeast, parasites. And so that looks like removing processed foods, things like breads and pastas. Gluten is a great thing to remove, for sure. And I suggest kind of doing it systematically and, small steps over time, as opposed to just jumping in with both feet. That's not sustainable. Yeah. I did that, but it's very stressful. And so stress is, when I think about inflammatory bowel disease or autoimmunity, stress really is more important, I think, than I'm saying that as a nutritionist, but
very important point.
The combination of both of those is very significant. So if your dietary modifications are extremely stressful, then we're doing a disservice. You have to be able to do these things systematically and slowly over time. But food is extraordinarily powerful, and food journaling can be a wonderful tool to be able to recognize, okay, I have an increase in bowel movements or I have a decrease in bowel movements when I'm eating or not eating specific types of foods, a decrease in blood or an increase in blood if I'm eating specific types of foods.
Yeah.
Those are my top kind of three things as far as just immediately starting with food. Food would be my first choice, besides dealing with stress release. As we all have stress, we will always have stress, but it's about taking that stress and removing it from the body, managing it.
Yeah, all such great points, food related, where we try to remove more of the foods that we know are inflammatory or more cause sensitivities, and especially with people who have ulcerative colitis. And so, but at the same time, not removing so many that you then don't have good nutrition with you. So I think it's a very careful balance to keep. You have to go slow. So all great points. And then the stress and sleep, those are two of the ones that, other lifestyle factors that, again, you can take all your medications and everything, but unless you have these core things figured out and you're working on them, which is a struggle for all of us, but we have to be on that path to try to figure it out, especially if you have an autoimmunity and especially if it's ulcerative colitis, to try to get those things in balance, because we know, contrary to what that GI physician said, we know that there is a lot of evidence linking sleep with better immune function, linking lower stress levels with better immune function, and obviously diet and nutrition. So all of those are core principles, I think, and really good that you mentioned all the diet and lifestyle related stuff. And so what I would say, kind of as we wrap up, is that the other thing that we try to go after is trying, we mentioned going deeper into the immune system, with looking at what the immune dysregulation might be. And that's really important to do. However, we also want to make sure that whatever the associated things with ulcerative colitis are, we are also looking into that. So for example, if you have, if you have a low-grade inflammation from it could be a pathogen, a bacterial pathogen that's in you. It could be a viral infection. It could be a parasitic infection, some other associated something that's driving the immune system. So sometimes, it's like you're trying to fix the immune dysregulation, but you need to fix first what is driving that immune regulation in the first place. And so that could be, treatment for, like I mentioned, a pathogen. It could be something food and related to something along those lines. So just important to get deeper into the cause. A lot of that can be identified by looking at different markers on our blood panels, doing certain tests that we do. And so all of that is going to be important and will play a part in the management of ulcerative colitis as a whole. So ultimately, what we want to just do is we want to take someone, and that's, it's so great that I get to speak with you, because you're someone who's lived and breathed through this process of ulcerative colitis. You're not just a clinical case of ulcerative colitis. You are a person who has experienced it. And as I mentioned in the intro, you mentioned everything that's related to ulcerative colitis and how it affects not just your day-to-day, but your sleep, your mindset, all of that, it gets affected. So when you get that diagnosis, we have to treat patients in that way in which we are able to incorporate all those things, that we are able to see them in that way, that they're going to be struggling with this more from just physical symptoms and how it affects them overall. So, it's just important that we have this overarching way of treating them well, in which they can thrive both physically, but also mentally, emotionally, spiritually as well. So that's, mainly what I wanted to say on ulcerative colitis. So if there's anything you want to end with or sum up with, please go ahead.
I just love that you pointed out that connection, that I would have loved to have had a practitioner that, at the time of my initial diagnosis, because there's the stress piece of it, because there's a lot of anxiety, there's a lot of not knowing, there's a lot of fear. Working with a practitioner that understands that it's not just the physical body, there's so much more to this disease. It's wonderful, and I'm grateful that you've taken on this role as a practitioner that sees the importance for treating the entire person and working with and journeying through this process with somebody, because I do believe that it takes that wholehearted approach, that holistic approach, to be able to help somebody get from the depths of a flare-up of UC to remission and, sustained remission over time. It really takes all of those things. So I'm grateful that you're out in the world helping people like me, work through this.
I'm grateful for everything you do and all the conversations that we get to have around this and everything that I learned from your experiences. So thank you for that. So, just to sum up for people, if you are either struggling with ulcerative colitis or think that might be a possibility in your case, there are better ways than what you might have been told. There are more holistic, comprehensive ways that you can be treated, and you should really seek out someone that does that. And I hope this is beneficial for people, and it proves as a good piece of education. And if anyone has any other thoughts, I would love to hear from people as well. And I'll end here. And thank you again, Cecili, for talking with me, and look forward to talking more on this subject.
Thank you so much, Omar.